With respect to what causes anxiety, one of the most significant influences we believe is our genetic history or predisposition. We say that half of our disposition is inherited, and probably most of our anxiety disorders fall into that category too. So it is not uncommon that people who are suffering with anxiety disorders also have family members who have suffered with anxiety disorders. It may be a very close biological relative, might have had the same condition. Often it may have gone undiagnosed because we were not as sophisticated as we are in identifying these conditions in the present day. Other factors can be modeling factors. The way people behaved around us when we were growing up can lead us to experience anxiety. If we had parents who were very cautious or always warning us or expressing their worry out loud, we may have learned to become worrisome in particular ways in the course of our life. There are also conditions in our culture that can promote anxiety disorders. If we go back and think about how our culture responded to catastrophic events such as 9/11, we had cultural anxiety in the aftermath of that. We started feeling much more alarmed, much more vigilant, paying much more attention to our surroundings. Going to the airport became different. In fact, we developed some obsessive compulsive disorder habits in airports. We started checking all sorts of things. So cultural conditions can also sometimes promote increased anxiety. There are certain individuals who may be more predisposed, again, based on their biological genetic predisposition. And if these disorders are undetected, they can go for long stretches suffering, and the condition can actually get worse. In the case of obsessive compulsive disorder, a well-known statistic formerly was that it took 7 years to get diagnosed once symptoms took place, and 17 years to get to accurate treatment. Now, I think we've improved on that, a little bit. But these are disorders that can often go undetected if we're not revealing them. And people with anxiety often are not quick to reveal them. An interesting thing that one notices as a clinician is that people with anxiety often look very relaxed and comfortable. In fact, many times they're often told by their loved ones or friends that they seem very relaxed. So this is another way in which people might experience anxiety. We think in many ways they master the ability to control their symptoms or the presentation of their symptoms, so they can often go for long stretches of time without them being noticed. Oftentimes people can feel somewhat ashamed of their anxiety too and try to conceal it, hide it from other people. Partly our culture continues to stigmatize anxiety disorders, and so individuals will often kind of hide away or protect themselves from having other people be aware of their symptoms.